Managing diabetes is all about controlling your blood glucose levels. High blood glucose concentrations damage your kidneys, nerves, heart, and eyes. What happens when the blood glucose levels drop below the normal concentrations? Is that a problem? The simple answer is yes. Hello everyone, I'm Dr. Sadia, licensed nutritionist, a board-certified lifestyle medicine professional, and a researcher. And today I will be talking about a very common complication of diabetes called hypoglycemia. When you visited your physician, he probably must have discussed with you about hypoglycemia. He must have discussed about how you should be aware of what is hypoglycemia and what to do when you have hypoglycemia. Let's take a step back and try to remember, what do you mean by normal blood concentration? A normal blood concentration ranges between 70 to 140 milligrams per deciliter for a normal person. For example, if you have not eaten for a very long time, your blood concentrations can go down to about 80, 85. And if you've eaten a meal with a lot of carbohydrate, maybe it can reach up to 130, 135 and sometimes 140. But it's always tightly controlled between 70 to 140 milligrams per deciliter for a normal person. But for a diabetic person, this control is compromised. And that's the reason the blood glucose concentrations go sometimes beyond 140 till 180 or maybe sometimes 200 milligrams per deciliter. But also the lower level falls down, and sometimes you can get into a stage called hypoglycemia when your sugar levels go less than 70 milligrams per deciliter, or if you're using other units, it could be 3.9 millimoles per liter. So what do you mean by the term hypoglycemia? Is hypo in a medical term means less than normal concentrations. Glyce is glucose and emia is in the blood. So when you put all this together, it means hypoglycemia, which is less glucose concentrations in your blood. But what is the hype about it? If your blood glucose concentration temporarily falls down, will it not kick back? Will it not become normal? Well, glucose is a primary source of energy to your body, just like a fuel to a car. And if it goes down, it can lead to complications and sometimes cardiovascular events and stroke. So this is not something very simple which you can ignore, but you have to be aware of it and you have to manage this. In hypoglycemia, the two most important things is you should know how to identify hypoglycemia and what to do when you have hypoglycemia. How do you know if you have hypoglycemia? The first things first is the person who, when he feels hypoglycemic, he does not feel normal. He feels something different. He feels he's not good. And there are a range of symptoms which a person can feel because of hypoglycemia. Half of these symptoms is because of the release of a hormone called adrenaline. And adrenaline is a stress hormone. So when your body gets into a stress situation like lack of glucose, it releases adrenaline, and the symptoms are rapid heartbeat, sweating, nervousness, trembling hands, palpitation, and dilated pupil. The other set of symptoms of hypoglycemia comes from the fact that your glucose levels have fallen below normal. It's a situation like starvation if you have not eaten for a very long time. So how do you feel if you have not eaten for a very, very long time? You would feel intense hunger, dizziness, confusion, lightheadedness, sometimes visual changes, numbness, tingling, slow speech, and also difficulty in walking, or if you're driving, you might feel really weak, you're not able to concentrate while you're driving. So as I said, there's a range of symptoms for hypoglycemia, and you should be able to identify if this is hypoglycemia or not. And to do that, you need to do the blood test. It's very, very important that if you're feeling not good and you're feeling some of the symptoms of hypoglycemia, you have to confirm it with a basic home glucometer test, which tests your blood glucose. And if it is less than 70 milligrams per deciliter or 3.9 millimole per liter, that means you are hypoglycemic. So what do you do when you know that you're hypoglycemic? There's a simple rule what you have to do when you know that you're hypoglycemic. It is called a 15-15 rule, which means you need to take 15 grams of carbohydrate, wait for 15 minutes and recheck your blood glucose. And if it is still less than normal, then again you need to repeat it by taking another 15 grams of carbohydrate. So I'm sure you must be thinking, what do you mean by a 15 grams of carbohydrate? How am I going to measure a 15 grams of carbohydrate? So when we talk about 15 grams of carbohydrate, I have it here. A small half banana or 1/3 banana could be about 15 grams of carbohydrate. Or 3 pieces of regular sized dates could be 15 grams of carbohydrate. Or regular small crackers or biscuits, about 3 in number, is 15 grams of carbohydrate. Or about a medium fruit or about 10 to 15 pieces of grapes is 15 grams of carbohydrate. Well, this is all 15 grams of carbohydrate, but these are all solid forms of carbohydrate. So it's going to take some time until you chew it and the body absorbs it, and the blood glucose levels raise. So when we talk about 15 grams of carbohydrate, the most easy and efficient way of raising your blood glucose is the liquid simple carbohydrate, which is fruit juice. About half cup of fruit juice, about 150 ml of fruit juice is 15 grams of carbohydrate. Not a full glass of juice. Generally, patients tell me that when you are feeling hypoglycemia, they start drinking juice and it's about 1 glass of juice or sometimes 2 glasses of juice because they want to raise their blood glucose. You do not need that, because if you're going to drink a lot of juice, it's going to lead to hyperglycemia, right? So what you need is about half glass of fruit juice, or if you have regular soda at home, I'm not saying it's a healthy option, but this option is good in emergency. If nothing is available, a regular soda of about 150 ml is also having 15 grams of carbohydrate. And if you don't even have that at home, the most easiest and simple way is take a glass of water, about 200 ml of water, and add, this is a simple table sugar. So you take a tablespoon and you take about 1 tablespoon of sugar and mix it in your 200 ml of water and stir it. And this will give you around 15 grams of simple sugar. So you drink this, okay? So this is very simple and it's available in all the houses. So if you cannot find anything and you're feeling anxious and you're feeling symptoms, the best solution is take a glass of water, 1 tablespoon of sugar, stir it up and drink it. There's also a choice that if you're traveling, you can keep hard candies with you, like these. These are hard candies which have mostly made of sugar. But the thing with these hard candies is you will have to take about 6 to 7 pieces of hard candies to reach that 15 grams of sugar. So you can keep them handy with you, but the best solution is to have a liquid simple sugar. The other option which is available, you can buy from your pharmacies, is the glucose tablets. The glucose tablets, you get tablets which are about 4 grams of glucose in each tablet. So you need about 4 tablets. You can just eat those tablets, and that will give you about 15 to 16 grams of glucose. So this is how you manage the hypoglycemia. But as I said, now once you start managing with your hypoglycemia and after 15 minutes, you're going to check your blood glucose again. If your blood glucose levels have reached the optimum level, not that you're going to again continue your life as it was, but you have to make sure that if it's a meal time, if it's a time for your lunch, if it's time for your dinner or whatever, go ahead and have your meal. And if there is a lot of time between your episode of hypoglycemia and your meal time, it's always good to have a snack. Have a snack, like you can have a small sandwich with brown bread, or you can have maybe a cup of milk, maybe a normal fruit, or you can have a small bowl of rice with some vegetable in that. A small, about 15 to 30 grams of carbohydrate snack, which is a slow digestive snack. Hypoglycemia can create anxiety and fear among the patients and also their family and friends, because it's a stressful situation. The only thing which can help to effectively manage hypoglycemia is knowledge about how to manage hypoglycemia, because knowledge is power. If you found this video helpful, please like and subscribe to our channel. We hope to make more videos which will help you in understanding how to treat diabetes with lifestyle choices of diet, exercise, sleep, and relaxation techniques. Thanks for watching, and see you in the next video.